I'm Ken Johnson, a 65-year-old male, been living in Sarnia for the past 30 years. I'm an executive. I work in the oil and gas industry, do a lot of traveling, and enjoy the area. Back in, I think, November of 2012, I had a regular PSA test through my family physician, and lo and behold, I got a call a few days later and said, got to come in and see me. You've got a high PSA reading. Subsequent to that, I was referred to Dr. Rajiv Singh here in Sarnia, the urologist, for a follow-up as to what exactly had happened. Sometime in December of 2012, Dr. Singh took some biopsies, and here at the hospital, Bluewater, and the results unfortunately showed that I had cancer. At the time, I was really uncertain as to what my next steps were. You don't want to reinvent the wheel. The doctor and his staff were excellent as far as pointing me in the right direction and giving me some documentation to read, but I didn't have any anecdotal information from people that had gone through this before. And at that time, I had decided to go with the radical prostatectomy. The decision becomes your own, and you've got to make that call. Crucial moments during the decision-making process. Unfortunately, what I found in some cases was the more I read, the more I started to understand prostate cancer and what it was doing and the implications it had for me, the more confused I became. And I needed to reach out to somebody and or in my own head get things straight so that morally I was positively motivated to proceed with the operation or the procedure that I decided to choose. Things were good. I had no pain, and I can only refer to what happened to me as in the actual removal of the prostate. As saying it was excellent. I had great people looking after me, and I was discharged on the 5th, 3 days later. And here I sit today. My PSAs every 6 months have been great. The results are negligible. And the best thing that happened to me in September when I saw Dr. Singh was he said, "Ken, you don't have to come back and see me until next year." You know, the PSA test is one of those things like, oh, I'm going in for blood work. Heck, I don't know whether my hemolytes are this or whatever, but the doc says, yep, we are within normal. And same thing with a PSA. A PSA is, hey, checks to see if you got cancer in your prostate. And it's just one of the things that men do, or should do, must do if they're, you know, in their 50s or so. And I never gave it much thought until I got a positive result out of it. But in my case, thank God I had a PSA. My experience and talking about having the prostate cancer, there's both positives and negatives. You can't say it's all positive, you can't say it's all negative. There's a balance in there. I'm willing to share my experience with others in the hope that they can come out of it the same way that I did. I feel I was one of the lucky ones that had prostate cancer. I wake up every morning and say, it's nice to be able to look forward to another day. I don't want to think about the fact that I am a survivor. I don't want to think the alternative isn't too good. And unfortunately, like I said, two of my friends passed away because of prostate cancer that either metastasized or wasn't caught in time. They didn't make the decision early enough. As a survivor, I mean, we get to carry on with life and do things that we want to do and achieve our bucket list with the help of the people that took out my prostate.